Hello everyone, welcome to Dental Subjects. Today's topic is about the mandible, a facial bone. Okay, let's get into the topic. What is mandible? Mandible or lower jaw is the largest and the strongest bone of the face. Okay, it is also the only movable bone in the facial region. It develops from the first pharyngeal arch around the Meckel's cartilage. Meckel's cartilage is nothing but the bony part of the first pharyngeal arch. Okay. Mandible consists of a horseshoe shaped body, okay, which holds the teeth. See the diagram. And the pair of ramus. Ramus is nothing but the projected fork from the posterior end of the body of the mandible. Okay. Next, the development of the mandible. Mandible develops by primarily through the intramembranous ossification. Okay, then some of the structures, that is the incisive part, condylar part, and the coronoid process, and upper half of the ramus develops through the endochondral ossification. Okay. First, we already discussed about the starting point of the formation of mandible in the previous class. That is the formation of mandibular process, right? During the 6th week of the intrauterine life, when the first pharyngeal arch starts to deposit on the lateral wall of the stomatorium, it gives rise to the mandibular process. Okay, that mandibular process, that mesenchymal cells in the mandibular process condenses to form this U-shaped arch. See the diagram. Then the primary ossification starts. Okay, from the two centers on either side of the arch. The ossification proceeds towards medially, that is towards the midline, and the diffuses in the midline. Okay, that part is known as that fusion occurs in the symphysis part. Then the ossification extends upwards from the body to the ramus of the mandible. Okay, then other growth, remodeling, and the maturation parts occur in the postnatal life, that is after birth. At the time of birth, the mandible consists of two halves connected at the symphysis by only the fibrous tissue. Okay, then after the bony reunion takes place during the first year of the baby's life. Then the anatomy of the mandible. Now we are going to see about the important parts of the mandible. Okay, you should recognize and remember each and every part and anatomical landmarks and their names. Okay, that will be helpful in understanding the upcoming slides, that is the muscle attachments and foramens, nerves and vessels. Okay, so listen carefully. We are starting with the outer surface parts. Okay, first the symphysis menti. Symphysis menti is nothing but a faint ridge. Okay, it is the line where the right and left half of the mandible meet each other. Okay, then the mental protuberance is nothing but a projected area below the symphysis menti, which forms the chin. Okay, then the mental foramen. Mental foramen lies on the lateral aspect on each side of the mandible, that is exactly between the two premolars of the mandible. Okay, it is the very important foramen through which the nerves and vessels transmits. Okay, then the oblique line. See the diagram. There's a line like structure, right? That is running forwards and downwards. Okay, this line is nothing but the continuation of the ramus. See the diagram, the ramus continuation. Okay, this is known as the oblique line. Then the incisive fossa. Incisive fossa is nothing but the depression below the incisor teeth, that is in the anterior region above the symphysis menti, that is known as the incisive fossa. Then we are going to see about the condylar and the coronoid process. Okay. What is the coronoid process? It is present in the ramus of the mandible. It is the triangular upward projection which is present in the anterior part of the mandible. Okay. Then the condylar process. Condylar process is very important because it is the part which forms the joint with the temporal bone in the skull to form the temporomandibular joint. Okay. It is just the upward projection from the posterior part of the ramus. Okay. It has two parts, that is the neck and head parts. The head part is covered with the fibrocartilage and it articulates with the temporal bone. Okay. The constriction below the head is known as the neck part. In the anterior surface of the neck part, there is a anatomical landmark called the pterygoid fossa. It has some muscle attachments. Okay. We'll see in the upcoming slides. Okay. Next part. Next, we are going to see about the inner surface parts. Okay. Now we see about the outer surface important parts of the mandible, then the inner surface parts. Okay. First, the mylohyoid line. Mylohyoid line is nothing but a line which runs downwards and forwards. Likewise, the oblique line, it downwards and forwards towards the lingual surface. Okay, in the lingual surface. It is very important because this line separates the submandibular and sublingual fossa. Okay, the submandibular fossa is the area below the mylohyoid line and the sublingual fossa is the area above the mylohyoid line. Okay. Then the genial tubercles. Genial tubercles is nothing but the elevations, small elevations in the posterior surface of the symphysis mentis. Okay. It is present in the near the base of the mandible. Okay. There are 4 elevations. They are known as the genial tubercles. And below the genial tubercles, there will be a small oval shaped depression. It is known as the digastric fossa. Okay. These each and every anatomical landmarks is very important. It has a specific muscle attachments. Okay. Then the most important part, the mandibular foramen. Okay, mandibular foramen locates at the occlusal level of the teeth. It is present in the occlusal levels on the teeth in the ramus of the mandible. It is also very important foramen which transmits very important nerves and vessels. Okay, then the lingula. Lingula is nothing but the sharp bony projection present above the mandibular foramen. Then the muscle attachments of the mandible. First, we are going to see about the masseter muscle. See the diagram. It is the largest muscle. Okay, it gets its insertion from the ramus of the mandible, right? Except the posto-superior part. Okay, all of the part provides insertion to the masseter muscle. Okay, then the temporalis muscle. Temporalis muscle, see the diagram, it is in the apex, that is the upper part of the coronoid process. Okay, not only in the upper part, see the diagram, it also extends anteriorly. Okay, this is the temporalis muscle. Remember the anatomical landmarks with the muscles. Okay, masseter, it is in the ramus. Temporalis, it is in the coronoid process. Okay, then see the oblique line. Okay, this oblique line gives rise to the 3 muscles. Okay, buccinator, depressor labii inferioris and depressor anglioris. Okay, first from its starting point, that is near the first molar tooth, it gives rise to the buccinator muscles. Okay, then in the front region, that is below the mental foramen, it gives rise to the depressor labii inferioris and the depressor anglioris. Next, See the diagram, just below these two muscles, the platysma muscle arises. That is, it is in the lower base of the mandible, in the lower border, right? Then see the incisive fossa. This incisive fossa gives rise to the mentalis and the orbicularis muscles. Okay. Now we are going to see the internal surface muscle attachments. Okay. First, the mylohyoid line. The mylohyoid line, the name itself indicates, it gives rise to the mylohyoid muscles. Okay. Then the superior constrictor muscle. Okay. The superior constrictor muscle arises from the posterior end of the mylohyoid line. That is, from the posterior part, the superior constrictor muscle arises. Okay. Then see the genial tubercles. The genial tubercles gives rise to a origin of genioglossus and the geniohyoid muscles. Okay. Then the digastric fossa. The name indicates it gives rise to the anterior belly of the digastric muscles. Okay. Then other muscles are the lateral pterygoid muscles. See the condylar process. Below the condylar process, in the neck part, it arises. That is exactly from the pterygoid fossa, right? We seen in the previous slide, right? In the anterior surface of the neck of the condylar process, there is a pterygoid fossa. From this fossa, the lateral pterygoid muscle arises. Okay. Next, foramen and its relation to nerves and vessels. There are two main foramens, right? Mental foramen and the mandibular foramen. The mental foramen transmits the mental nerves and its vessels, that is the blood vessels. Then the mandibular foramen transmits the inferior alveolar nerves and its vessels. Okay, these two foramens have a clinical significance in administrating local anesthesia for the dental procedures. Okay, other than the foramen, what are the structures that passes to the mandible? Okay, first one is the mylohyoid nerves and vessels. These runs in the mylohyoid in relation to the mylohyoid line. You all remember the mylohyoid line, right? Then the lingual nerve. Lingual nerve is also on the, it runs from the median surface of the ramus to the mylohyoid line. Okay. Then the mesenteric nerves. The mesenteric nerves and vessels passes through the mandibular notch. Okay, mandibular notch is nothing but the U-shaped structure between the coronoid and the condylar process, where the mesenteric nerve and vessels passes. Then the auriculotemporal nerve and superficial temporal artery. They are present in relation to the neck of the mandible. Okay, median side of the neck of the mandible. Okay. Then the facial artery. Facial artery is the one of the largest artery which is palpable on the lower border of the mandible, especially at the anto-inferior angle of the masseter muscle. Okay. Then the important ligaments in relation to the mandible. The sphenomandibular ligament, it is attached to the lingula. Okay. Then the lateral ligament of the temporomandibular joint. It is attached in the lateral surface of the neck of the mandible. Okay. Then the pterygomandibular raphe. It is attached immediately behind the third molar of the oral cavity. Third molar is the last tooth of the oral cavity. Behind that, the pterygomandibular raphe is present. Okay. Then the important salivary glands. There are three salivary glands, right? Parotid, submandibular and sublingual. All these salivary glands occurs in relation to the mandibles. This is the end of our class. If you have any doubt, please kindly share it in the comment section. Thank you.